everyone, welcome back to our channel. In our OET speaking task, when we speak about understanding patients' perspective criteria, it mainly focuses on eliciting and exploring the patient views. It means asking questions to understand what they think and feel. Relating your explanation to their views shows that you have listened carefully and that you respect their perspective. These steps help create a collaborative and a compassionate dialogue, ensuring that the patient voice is heard in their care journey. In the context of OET speaking under clinical communication, one of the critical aspects of understanding the patient's perspective is recognizing patient cues. So, cues can be both visual, it could be like facial expressions, and audible, which is like words, sounds, or phrases. So these cues often give insights into how the patient is feeling about the information that they are receiving. For example, visual cues such as facial expressions can convey a wide range of emotions like shock, fear, agreement, confusion, or even happiness. At the same time, these visual cues are usually paired with audible cues, words or short sounds that further express the patient's emotions or concerns. These can range from a full sentence to a simple sound like mm or oh. So these short expressions or sounds often indicate the patient's feelings or reactions like doubts, confusion, or concern about the information being discussed. Let's see some of the positive cues. Example, I see what you're saying. That's clear. Here, this verbal cue indicates that the patient has understood that information you have provided and is feeling more comfortable or reassured. Let's see some of the negative cues. When it comes to negative cues, here the patient is saying, but mm, or oh. So these responses often signal that the patient has concerns or doubts about the information or treatment options being shared. So it is very crucial to pay attention to these cues, whether they are long or short, as they help guide your next response. If you ignore or overlook these cues, it may cause further confusion or discomfort, or it may cause anxiety for the patient, which could make the situation more challenging to manage. Let's see an example here where a nurse is explaining to a patient how to use insulin injection. Okay, and have you ever used insulin injections? No, no, I'm very afraid of injecting insulin. Okay, let me explain that to you. As I mentioned, your blood sugar levels are high, so you need to use insulin injections at home. I will explain how to use the insulin injection. The needles are disposable, and the procedure involves injecting into the subcutaneous layer, which is the superficial layer of your skin. Oh, so don't worry, I'll show you how to correctly use the needle on your skin. You just pick the subcutaneous layer and insert the needle at a 45-degree angle. It should be slow and steady and you won't experience any side effects. But if you feel dizzy or have a headache, contact a doctor immediately. Oh, that sounds very scary. I mean, I don't know what that layer of skin is. And the pinching, everything sounds really scary. In this scenario, the patient is increasingly anxious, as shown by the verbal cue. Oh, that sounds very scary, and describing her fear about the pinching sensation. However, the nurse misses these cues and continues with the explanation without addressing the patient's growing concern. So, a better approach would have been for the nurse to first acknowledge and validate the patient's fear. Let's see an example for this. I understand that you're feeling scared about the insulin injection, and that's completely normal. Many patients feel this way when they first start. Let me explain in a bit more detail, and we can go over it together step by step. By addressing the patient's emotional cues immediately, the nurse would help ease the patient's anxiety and she could build a stronger, more supportive communication foundation. Let's see another example in a different context blood pressure management. The doctor is saying, I need to check your blood pressure today. Oh, I'm a little worried about this. I have had high blood pressure before and I'm not sure how it's doing now. Here's the patient's audible cue. Oh, I'm a little worried. So it suggests concern about her blood pressure, right? The doctor should acknowledge the patient's anxiety before proceeding. So the doctor is saying like this: I understand that you're feeling worried about your blood pressure. It's completely normal to feel anxious, but we'll take it step by step and review your results together. Don't worry, we'll make sure everything is okay. By responding to the patient's cue, the doctor can reduce the patient anxiety and proceed with the checkup in a more supportive and calming manner. And the next one is the third clinical communication criterion assessed in OET speaking focuses on how well you structure your conversation. There are three key indicators you need to demonstrate during your interaction with the patient. The first one is sequencing the interview purposefully and logically. Second one is signposting changes in topic using organizing techniques and explanations. So, when it comes to sequencing the interview purposefully and logically, this indicator can be broken down into two main aspects. First one is purposeful, and the second one is logically. Both of these terms are vital when you're engaging in a healthcare conversation with a patient or their relative. Let's see purposefully. As the healthcare professional, you are in charge of managing the discussion, right? So, this means that you are the one who initiates the conversation, decides how long to spend on each topic, and when to transition from one point to the next. So, you should start the conversation with a clear intention and structure, ensuring that you cover all necessary points while making the patient feel listened to and informed. You should not simply follow the patient's lead or let them dictate the pace. Instead, you need to steer the conversation while still being attentive to the patient needs. If the patient asks an in-depth question, that's perfectly fine. It's a natural part of the consultation, right? However, if you let the patient continuously steer the discussion, it could disrupt the balance of the conversation and your precious time will get wasted. The second one is logical sequencing. To keep your conversation logical, you should follow the sequence of tasks provided in your OET card. So these tasks are carefully arranged to ensure the conversation flows smoothly from one topic to the next. They are in a very structured way that allows you to cover each point comprehensively before moving on to the next, ensuring that no part of conversation is left incomplete. By sticking to this logical sequence, you can avoid returning to previous points unless absolutely necessary. For example, if a patient asks a relevant follow up question, it ensures that the consultation moves forward in a natural and well organized manner, right? In most healthcare settings, time is limited. And as a professional, you should balance covering essential information with the time constraint of the consultation. During the OET speaking test, you are given a limited time, usually 5 minutes, to communicate important information to the patient. So it's crucial to allocate your time wisely. If you spend too much time on a single topic, you may not have enough time to address the other important areas. However, if you rush through the conversation, the patient may not feel heard or fully informed. So you need to have a balance. By planning ahead, you can ensure that the time is used effectively and you can meet both patient needs and the required content. Remember, when you are making the balance, so you should put the required content within the allocated time frame as well as you should consider about the patient needs. So these skills are very important in balancing thoroughness with efficiency. And that's all for today's videos. Kindly like, share, and subscribe. See you in the next video. Bye bye.